I'm Vanessa Nguyen, Nurse Practitioner. I've been doing outpatient neurology for about 4 years now. Before this, I was actually a nurse for about 7 years in the neuro ICU. And before that, I had a degree in neuroscience. So I've always been really fascinated about neurology. My favorite is migraine and dementia. I was first trained in migraine and dementia, and so I have a soft spot in neurology for those two conditions. My approach to treating patients is fairly individualized. Whenever a patient comes to me, I always want to figure out kind of their goal for treatment. So if they are focused on treatment or mostly they just wanted to be heard, I just want to be able to be in alignment to whatever they're searching for. I think patients need the most access to care, which is what drew me to neuro in the first place. And secondly, I think patients need to have a provider that's willing to listen to whatever they have for concerns. Patient first care matters to me because a lot of times as providers, we see patients as a clinical diagnosis, and in some cases, even in the hospital, as a room number. So when we really listen to the patient of who they are, I think it allows us to, as providers and to see patients as patients and people. So it allows for a better connection and all kind of better healthcare overall. I do not have a chronic condition, but my grandma is actually suffering from dementia, so that kind of holds a close place in my heart. I do love how there's a new wave of medicine and new treatments coming out for dementia, so that gives me hope. And, being a part of this change is going to be very helpful for patients going forward. When I support her, it's more an empathetic standpoint. So I always want to listen to her, hear her concerns. Sometimes her concerns don't exist, right? So some of her ideologies are hallucinations, but as long as I'm there with her in the present, that's kind of what matters to me and to her. And then we can share that moment. And I think that's a big part of healthcare that we're missing alongside with the formal medication and diagnosis.